Right, let's do the headlines. And former President Jerry John Rawlings has been lamenting the unsanitary conditions that have plagued parts of the country. Now, he says the situation can best be described as retrogressive, considering the level of the country's development. Mr. Rawlings was speaking at a sensitization ceremony for the construction of Cleveland A. Morgan Mother and Child Center at the Mamubi General Hospital here in Accra.
Como Ghana, what roads, and the infrastructure, development, now Jewayi, and yet a sunny Nekemman who is investing so much in the infrastructure, can it be universities, you are here, can it be a sunny joy amowo to the extent that it has, yeah, Ghana, yeah, Accra, yeah, Kumasi, therefore. This is retrogressive. It's an uncivilized behavior. Time in the past, we were care health facilities there, and we comported and conducted ourselves in a very responsible, disciplined manner. It was a better reflection of the quality of the human being. You're so efficient, compassionate, can it be? You need to bring your influence to bear on many men are not pulling up their weight. Otherwise, say, I fit a fan or bear, I fit your fan, your bear. Nibi come, ni esane biomo, ni bemen boy, because of irresponsibility now, a low lack of proper, discipline can it be.
Former President Rawlings there. Now, the Environmental Protection Agency will from June this year clamp down on motorists and motorbikes who emit smog-forming pollutant from vehicles and motorbikes. Deputy Director of the EPA, Ebenezer Apa Sapon, announced that his outfit will come up with a new standard to decrease emissions of dangerous pollutants from engines. He made these statements at an Accra Metropolitan Assembly roundtable discussion on climate change. Henry Kwesibedu was there. Here's his report.
Dangerous fumes. Exposure of carbon monoxide can cause headaches, dizziness, nausea and fatigue. Overexposure, however, could lead to death. Unfortunately, many vehicles and motorbikes in the country emit such poisonous fumes which can harm lives and the environment. With transportation being a major cause of air pollution in Ghana, the World Health Organization estimates that air pollution kills an alarming 28,000 Ghanaians in a year.
Air pollution today kills around 7 million people globally, and that is very much the case for Ghana and for Greater Accra region as well. In particular, for Greater Accra region, the initial estimates derived from the collaborative effort of the Urban Health Initiative show that every single year about 2,000 people die due to air pollution-related conditions. And what does that mean? Which are the diseases affected by air pollution? These are respiratory diseases, but also cardiovascular diseases, myocardial infarction, stroke, also lung cancer, pneumonia, particularly for children, but also for adults.
In densely congested traffic, drivers, passengers and pedestrians are exposed to a cocktail of harmful fumes. Acute respiratory illness caused by air pollution is one of the top 5 causes of outpatient hospital visits in the country, according to the Ghana Health Service.
Sometimes when people die and we are doing post-mortem, when we cut them open and we slice up the lungs, you see black dots in the lungs, telling you how much of these things they have inhaled over the course of their lifetime.
However, from June 2019, the Environmental Protection Agency says it has an elaborate plan to deal with the problem. Ebenezer Apa Sampong is Deputy Director of the agency.
We've been working to introduce some motor emission control systems or programs in this country. The first block is to do the studies which we have done to develop a standard for vehicular emissions, and fortunately that has been done together with the Ghana Standards Authority. So now we do have a national standards for vehicular emissions. Your vehicle will have to go through some remedial process to ensure that the engine is fixed, and then before you can be brought back onto the road. The standard certainly will be adopted this year, hopefully in June.
One of the greatest challenges the human race is confronted with is that of global warming and climate change, which is mainly caused by emission of dangerous gases, with exhaust gas known to pollute the air more often due to the increase in demand for the use of motor vehicles. In the world at large, Ghana has a lot of work to do to achieve SDG goal of ensuring good health and well-being. Henry Kwesibedu's report for JoyNews.
Right, let's stay with the health theme for a minute. The Health Minister, Menu, says government has adopted a new strategy to achieve the targets of eliminating HIV/AIDS epidemic by 2030. Speaking at a meeting at the Meet the Press series on Thursday, he noted that the ministry and its agencies have faced challenges in dealing with epidemics since 2017. Mr. Menu says steps are being taken to address the issue. And Asmenu was there for us. Here's his report.
In 2014, the Joint United Nations Program on HIV/AIDS and partners launched the 1990 targets with the aim to diagnose 90% of all HIV-positive persons, provide antiretroviral therapy for 90% of those diagnosed, and achieve viral suppression for 90% of those treated by 2030.
Government has made modest gains towards achieving the 2030 target of completely eliminating HIV/AIDS from Ghana. However, recent reports show there's a decline in the performance. Health Minister Menu gave this update at the Meet the Press series in Accra.
In 2016, the first 90 were at 40%. That is for testing. For treatment, we are at 39%, and for viral suppression, 58%. So we were nowhere close to the 1990. 2017, we moved to 62%, 45%, 51%. 2018 December, our statistics indicate 69% for testing, 38% for treatment, and 66% for viral load suppression.
The increase in prevalence rate is a source of concern for government. Their efforts to reverse the trend and take Ghana back on track to achieving the 2030 target.
We have had challenges with procurement of supplies for treatment, and we have identified this area as an area that we need to improve. So that has become a challenge for us, and we are now adopting a new roadmap to tackle the HIV/AIDS challenge. And we believe that by 2020, we will change these indicators and move closer to achieving the 90 by 2020.
Meanwhile, government lost $19 million of funding for HIV because it failed to raise counterpart funding of $17 million. JoyNews, however, understands the Health Ministry is in talks with Global Fund to ensure the decision is reviewed.
Now, at least 10 hernia patients undergo surgery every month at Nkaria-Tuase Government Hospital in the Ashanti region. High prevalence of the disease in the predominantly farming area is attributed to strenuous farm work. Love FM's Kwesi Deborah met up with members of the Society of Family Physicians of Ghana as they prepared to operate on 30 patients suffering from the condition.
Over 30 hernia patients, 5 of them children, were operated upon during a medical outreach by Society of Family Physicians of Ghana. Dr. Eric Kwame Deto is medical superintendent of Nkaria Government Hospital.
On the average, we do about 10 cases of hernia. And it's common because we are in a farming community. And also the type of work the people who are living in this district, they do also expose them to having the hernia disease. And when they come, we do our best to operate on them.
A member of the surgical team, Dr. Sefrimpong, advised mothers to be vigilant and report the condition in children for early attention.
The 5 kids are also coming with, some of them will be coming with 2 and 3 hernias. And we are still working on all of them. what we realize is that hernia, usually we have this congenital component. That is to say that you are born with weak parts of your body that you might develop the hernia through. So with the kids one and the advice, we might not say much. All that we'll do is to advise the mothers that anytime you realize or you notice your kid has hernia, you have to be observant. Always observe the kid. If it pops out, try pushing it out. Try pushing it in. If it doesn't go, report to the hospital.
Society of Family Physicians of Ghana says inadequate funding for training of practitioners has long-term implications for healthcare delivery. Organizer Dr. Fred Bezra says more doctors are needed in the field to ensure universal healthcare coverage. He says increased number, especially of physicians, will narrow the widening doctor-patient ratio gap. Dr. Bezra was speaking on the occasion of 20 years of family medical practice in Ghana.
Government has done a lot. Of course, we have modular programs now where family medicine residents stay in their hospitals in the districts and still specialize. That's a very significant step, but more can be done. Funding should be increased to training of more family physicians.
The society undertook free screening and treatment for residents of Nkawi and Twase in the Chumanwabiaja district. A debating contest to mark the anniversary saw Kwame Nkrumah University of Science and Technology emerge tops. Garden City University College, Christ Apostolic University College and University of Education Winneba Kumasi were other contestants. The topic was, after 60 years of independence, Ghana is close to achieving universal health coverage. Reporting for JoyNews, Kwesi Debra.
Right, now before we go, the ban on drumming and noise-making is in full force, and not even the presence of the First Lady, Rebecca Akufo-Addo, at an event would let the Wulume and Name tone it down. Hannah Odame reports how chiefs also present at the commissioning of the Rebecca Pediatric Intensive Care Unit at the Kolebu Teaching Hospital expressed anger when the audience clapped.
At any event, it's normal to clap when a guest is introduced.
Mrs. Rebecca Akufo-Addo.
That was exactly what the audience at the commissioning of the new Rebecca Pediatric Intensive Care Unit was doing when the chiefs were introduced.
Nana Adede Akwandeng Keteku. Nana Wopeyo Dadechu. Na Akuya Mempe Mehwasem. Na Ode Mwao.
This prompted the MC to plead for the chiefs to allow for some clapping.
I would have to plead on behalf of all of us who are not accustomed to Ga Adangbe culture that you pardon us in view of the excitement and the euphoria that we just clap for today. We know that it runs counter to the tradition of the Ga Adangbe at this particular time. Respectfully, I ask for your pardon. Thank you.
But not everyone remembered this piece of advice, so the clapping and noise-making continued, prompting another caution, this time by the health minister.
The MC has pleaded with Nime Name that they should allow us to do clapping and, a little bit of noise. But I also plead that we bring down the tone a little bit in respect of culture and tradition.
In the end, a drumming and poetry recital segment on the program was limited to only the recital. Just a reminder, the ban on drumming and noise-making is in full force. For JoyNews, my name is Hannah Odame.
Yeah, time to switch from hip-hop to jazz for a month. But that's where we bring the stories to an end. We're kicking it all off with traffic and newspaper headlines, sports, and everything that follows, including very important conversation with ACP Kwesi Ofori, the commander of operations for the Greater Accra region. We need to know how safe we are in light of these terror warnings. And we'll talk about other police issues as well. Bring through your questions, hashtag AskThePolice. But I'm going to go and hashtag practice my dance moves because Kwesi Appa is coming in just a moment. I'm excited. I'm sure you are too. Stay with us. We're back after these.